An interesting study by the CDC raised some eyebrows when they announced that 1 in 5 children are diagnosed improperly with ADHD. Now, according to the guidelines, kids should show signs of impairment in 2 locations, such as home and school. But some children are being diagnosed based only on information from family members, and many are being diagnosed before the age of 6. That's usually too young to tell. Well, earlier I spoke with Dr. Sujatha Reddy about this study. Point out, Dr. Reddy, 4 out of 5 times the diagnosis was being determined correctly. But this does raise the question about overdiagnosis and over-medication as a result.
Yeah, you know, we've seen these numbers go up every year. Anywhere from like 5% per year is the increase in the diagnosis. So that is very important to discuss, and that's what we're seeing here. You know, and it is a hard diagnosis because there's no specific blood test or x-ray you can do. It requires really, you know, a combination, a team approach from parents and healthcare providers, talking to the child, talking to teachers to really get an accurate diagnosis. And the American Academy of Pediatrics came out a few years ago with some really good criteria, and the report seems to show that for the majority of healthcare providers, they're appropriately applying this criteria.
We talked a little bit about younger than 6 and how it can be difficult to determine a diagnosis. Is it that it's difficult or impossible?
Well, I think if you talk to any parent who's got a 4 or 5-year-old, they'll tell you it's impossible because what we're looking for are what we would probably consider normal behavior patterns for a 5-year-old. They can't sit still. They interrupt you. So things that are probably normal. I don't think I can say it's impossible to diagnose. I think it would be harder at that younger age. So if you're a parent out there and this is very confusing, I think what you need to do is if your child has been diagnosed with ADHD and they are 4 or 5, perhaps you monitor them closely, and then maybe you have them reevaluated by your healthcare provider as they get older to see, was this really an accurate diagnosis? Well, and perhaps they'll outgrow it.
And that's an interesting point because we talk about over-medication and when is the right time, even if the child has been diagnosed with ADHD, to medicate.
So in that younger population, it's actually recommended that you start with behavioral therapy, and then as they get older, if they still have signs and symptoms, then you move to medications. Because these medications, as we know, can have side effects, and a lot of parents will actually give their kids a drug holiday because they're so concerned about medicating such a young child. So it's not a super straightforward kind of thing.
What kind of suggestions do you have for parents that say, even if my doctor recommends medication, I'm frightened to do that because some of these medications, I mean, frankly, you can compare it to some scary adult drugs. I mean, it's scary for parents to not know what to do if they don't want to medicate their kids.
You're exactly right. We're talking about stimulants, which we know can affect appetite in children, and perhaps, maybe not long term, but in the short term, it's been suggested they affect growth. So for parents, it is sort of a confusing issue. But for kids who really do have the signs and symptoms of ADHD, medicating them, maybe even trying it, if you see a mass improvement in your child's behavior in school and how they're able to learn and function, then maybe you know it is the right thing for your child. Depending on their age, I think behavioral therapy is probably the best way to go because there's going to be no side effects. And I think this is one of those conditions where we really have to customize treatment child per child. Even amongst siblings, it's probably going to be different.
You know, I think that's such great advice, and it's so frustrating for parents that don't necessarily know exactly what to do, but you've been a great help. Dr. Reddy, thanks for being with us.
Thank you, Lynn.